Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hey, everybody. I'm Dr. Mary Ann Pinkston, and this is The Better Life with Dr. Pinkston. And today, I am so lucky. I have a fantastic guest. And I have to do a little personal side of this because usually, got somebody always have somebody very astute, and today is the case. But I know this person well, and we went to residency together here at Christus Santa Rosa in San Antonio, Texas. And what's beautiful about it is we both took an integrative medicine route. I didn't know she was doing it, and I guess she didn't know I was doing it. But we have kind of reunited periodically over the years and shared a lot of great integrative thoughts and whatnot. This is Amy Offutt, Dr. Amy Offutt. And, she has accomplished quite a bit. I think the two most prominent things that I've seen is here in Texas. She's here in Texas. I think you're up at kind of the Marble Falls area, which is a beautiful, beautiful area in Texas, especially bluebonnet season. But Governor Abbott appointed her to the Acute Onset Pediatric Neuropsychiatry Council. And you'll understand why in a minute. And she's also president of the board of directors for ILADS, which is International Lyme and Associated Disease Society. So we've got a lot of interesting things to talk about this morning. I think we kind of agreed upon just complex chronic illness. What the heck is wrong with me? We'll get into that too. So Dr. Offutt, Amy, welcome in. It's so lovely to see you today.
It's great to see you too, Mary Ann. I can't believe it's been already 25 years since we were actually probably 26.
I think
we were medical students and residents together for like 7 years.
Absolutely.
We were young and learning a lot, but
yes, absolutely. And great minds think alike, right? So I think it's wonderful. And because we really didn't have kind of an integrative with our residency training, but we did have a lot of open minds and great people that we saw who really cared about patients. And so we were open to thinking outside the box, I think. Dr. Martin and everybody up there.
Yeah.
Wonderful.
Well,
tell a little bit about you, how you kind of got into this, and then we'll get into chronic mystery illness, I think is the best way to put it. What is wrong with me type of thing. But tell us about you.
Okay. Well, as you know, I always wanted to be a family doctor, and I did vary from that a couple times in med school when I got enamored by other specialties for just a moment or two, but it's because I was really interested in a little bit of everything. And then I got what I thought was going to be my dream job at working at a little rural 33-bed hospital in Llano, in the Texas Hill Country, where there's like not much medical care for many miles. Like that was a little island where a lot of people, country people, and a lot of older, like I think Llano County has like one of the oldest populations in Texas. So a lot of older patients where that little hospital served as a place for people to go who didn't otherwise have very close medical care. And I worked there for 7 years, and I delivered babies and, went to the nursing homes and did hospital work and clinic work. And I loved it for the first 5 years or so. Yes. And then a new management group came in and started really changing things and like putting a lot more pressure to see more people and do more in less time, and, without a nurse, and like just different, like a lot of different things happened that changed the environment of the work to a different environment. Looking back on it now, I'm actually grateful because the negative feelings I had pushed me out of that into another type of medicine, which I'm so glad that happened as early as it did. So anyway, I ended up leaving after 7 years and becoming just outpatient, and started looking at a lot of other different ways to approach patients, because I'd also realized that a lot of my patients weren't getting better with the things I was, helping them with. Like I would be treating someone's, blood pressure, and I just couldn't get their blood pressure better. And I just knew very little about anything besides the medication route because we just weren't taught it, Yep. So I started learning, and it was like a whole new world of information just opened up that I think you are too, like lifelong learners. Like we didn't think the minute we finished our training that we were going to stop learning right then. We knew there was going to be more to learn. And a lot of the learning comes from just observing patients. Like what happens to a patient when you give them this, or when you advise them that, or, when they do things for themselves. Like one of the most interesting things I would say, just having curiosity, is a patient comes in and they're better and they tell you what they did to make themselves better. Like I have a lot of curiosity about, well, what was that? Doesn't mean that I'm automatically going to tell every other patient that. It just means it's a little more to take in and understand and maybe go read up on. And I've learned a lot from my patients. So, and we all should be, right? We should be observing our patients and not, telling them they're wrong, or telling them they don't know, or telling them there's nothing wrong with them. So I think that's how it sort of directed me a little bit more down the path of integrative medicine. And so I did A4M initially and learned a lot there, and then did the Master's of Integrative Medicine at George Washington University, back in my time when I was spending more time with Dr. Heyman, and then did my board certification in integrative medicine. And I'm not against family medicine, but I have just moved on from kind of the concepts of like these quick.
You grew up.
Yeah. Like I don't want to give a medicine for a symptom and then just watch the patient and just watch the patient's med list grow. I want to actually like see them thrive and get their health back. So, and I didn't know how to do that until I went back to school and learned more. So it's kind of sad that has to happen, but at the same time, like there's so much to know. Unless they really hugely revamped medical education, I don't think they could do it. Plus, it doesn't really fit in the current medical model because it's not quick care. It's more intensive, singular, complex care. So anyway, that's kind of what I got here. That's about 25 years.
Worth. And so, in a very similar space for me too. I think I always say this to people. It's like once the light bulb goes off, you cannot shut that light off. That's it. Curious, and you go down the road, and there you are. And 25 years later, here you are. Right? Same story for me too. And I think as well, if something you described back when you said, you were enjoying the first few years being a rural doctor and doing what you do. And then the landscape changes when the corporate, bugs come in and take over. And you're right, they want you to see more and more. And that's the insurance model. We came into medicine right as insurance was starting and taking over. That was right at that flux. And we were warned in residency of what was coming. So we knew, but I did not know it was going to do what it did. And here we are, right?
Yeah.
But I guess staying on topic because that's a huge topic in itself. Mystery illness. So what if we say that, what does that mean, and what do we do about it?
Well, I feel like every day when I'm seeing patients, I hear their stories, and a lot of them have been to a lot of doctors, like a lot of regular doctors. Mm-hmm. And some of those doctors have been very kind to them, but like they're not looking at their case through a what's causing this lens. They're looking at it as what do we give you to try to make your symptoms less, which I still like to do that too. I want to eliminate suffering, but I also want to be looking for underneath it what could be causing it. Absolutely. And so I think that is the mystery. The mystery is what's causing it. And patients nowadays with so much information at their fingertips, like if their doctor doesn't answer their questions or make them feel comforted or reassured, they are going to go to the internet. They are going to try to figure it out for themselves, or someone that loves them is going to do this. And then they're going to come in with these things that sound preposterous to someone who hasn't learned about them. They're going to come and say, I have Lyme disease, or they're going to come say, I have mold illness, or they're going to come say, like
something, right?
I don't know what this is, but something's really wrong with me. And they may have already had a little, I would call it a cursory workup that says, oh, your white count's normal. Oh, you're not anemic. Oh, your thyroid's fine. And so you're fine. And they're not fine. They feel terrible. They're tired. They're low. They have just a lack of vitality. And a lot of them have pain and sleep problems and digestive issues too. And so it's not super simple. That's why it's kind of mystery. Like it doesn't sit well in the template of treating patients where we're looking for one thing to treat with one intervention at a time and then see them again in a month. It's not like that. It's really more multifaceted, and the only way to look at it is like a big puzzle. Like each person is their own puzzle and trying to piece together the puzzle so that you can figure out what's going on so that it can be as much as possible optimized or undone or addressed. And then hopefully behind that is just better health and like resolution of those symptoms without it just being done with a medication, which often doesn't help. Like a lot of people are not very tolerant of polypharmacy these days. And, like I saw that in my grandparents. My grandmother always was super busy working, doing things around her home. And then once I went to see her, she lived in Southern Illinois, and she just didn't get out of her chair, and she had normally made food. There was no food. She had gotten someone to pick food up, and she just didn't get up from her chair. And I sat down beside her. I was probably maybe, I don't know, this was probably 15 years ago. And I put my hand on her wrist and felt her pulse. I don't even know why. I just did it with patient, so I just did it. I wasn't even thinking. And her pulse was like 40. And I was like, Grandma, what's going on? And she's like, oh, honey, I guess I'm getting old. But her pulse was so low. And so then I asked her, what medicines are you on? And she showed me, and she was on way too much. Like she was on a beta blocker and a calcium channel blocker, and both of them were lowering her heart rate. And both of them had a Sharpie on the top that said 2X. And I was like, what does this mean? And she's like, oh, my heart doctor doubled them up. And like, I was like, how long ago was that? She's like, I don't know, maybe 6 or 8 weeks ago. And I was like, how long have you felt so tired? And she was like, oh,
6 or 8 weeks ago.
And then I was like, you have to get this undone because this is not you. And so my aunt took her back to the cardiologist, and he said, you'll get used to it, Helen. And then I was so mad. And so anyway, we got a second opinion, and thankfully, like she was able to get those medicines adjusted before she just sat so long in that chair that she got deconditioned to it. And she got back up again, and she lived about 5 more years. But it's just that stuff happens all the time, like where
it does, doesn't it?
It's like, I don't care if a paper says that being on a beta blocker prolongs your life if your life is sitting in a chair,
Yeah, it's
so
not.
like she was already on it, but she just had her dose increased, and then there was just no appreciation for it. So anyway, sorry for the side story, but even watching that
It's true.
in my family, it just happens. And it's like people are like, even that cardiologist, I'm going to cut him a little slack. He probably is in such a hurry to get to the next patient. He doesn't have time to really sit with her and talk to her about what does she do? Like, what is her normal routine and now what's happened when we started these different doses of these medicines. So it's kind of sad. It sort of takes the personal out of it and the human out of it and makes it more of like an application of the algorithm. And I just don't like that. So
I just can't do that. That's why I'm so thankful to be in solo practice where I can do what I need to do for my patients because, oh my goodness, believe me. And so, when patients, I notice a lot of patients now use AI and come in and will, search things up on ChatGPT. I've got a friend of mine who that's her veterinarian is, chat. And it makes me insane, which like you say, people don't do that because they think they can do it on their own. I think there are some people who feel that way, but I think it's because they're not being heard and they feel they have no choice. There's a desperation. I understand that. Rheumatoid arthritis or whatever it is, and have for 19 years and felt awful and been in pain. And talking about, I understand that desperation. And, if your doc is not listening to you, what do? You go look something up. But what are some of the common causes now that, that you see with patients that feel this way?
Well, it's funny. Patients will come in and say, you always treat mold illness first. And honestly, that's not true. Or you always treat infections first. And honestly, that's not true. It's very individualized. So most patients have a little bit of a few things wrong with them. And when I say a little bit, I don't mean that it's minor as far as how it presents. I mean, it's like part of the list. And so many patients have infections with bacteria like Bartonellosis, borreliosis, which is, Lyme disease is just one little small subset of species of Borrelia. There's a bunch of other ones too that fall into a different category called tick-borne relapsing fever, that when, one reason when people go to their regular doctor and they get tested for Lyme and it's negative, that they get told they don't have Lyme, is maybe they don't have Lyme, but they may have a different borrelial infection, or they may have Bartonellosis, or they might have the babesiosis, which is a parasite. So, and or others, like the list is not even limited to those. Those are just some of the ones that we kind of see the most. All of them have kind of nuances as far as you can clinically try to figure out which one based on symptoms. Like usually like the babesiosis will be accompanied with sort of drenching night sweats. That becomes challenging when you've got someone who's also potentially having menopause or, some other co-occurring infection, but still, they deserve the workup. And so things like borrelial infections will usually cause migratory pain. So like one day your left knee hurts, the next day it's your right elbow, the next day it's your left wrist, kind of, it doesn't have to be one joint either. It could be multiple joints and they kind of move around. It's not that, I've had patients come in and say, my right knee always hurts. I know I have Lyme disease. Well, maybe, but that's not a hallmark, like standout symptom of it per se, even though there's a lot of other causes of joint pain. Bartonella, a lot of people have skin involvement. A lot of people have this, kind of the new buzzword with patients is mast cell activation, which is really just like a regulation of reactivity to almost anything. Like I tell patients, like the only thing predictable about mast cell activation is that it's unpredictable. So cold water, warm air, the same things you've been exposed to before can trigger a reactivity where you feel either itchy or you feel heart palpitations or you feel dizzy, you can get a headache. It's not histamine only issues. Like histamine is one of the kind of the negative players in the systemic reaction, but there are other things too that make people feel exhausted or, just it's way more than a runny nose or itchy eyes or itchy throat like a regular allergy. So, there again, the mystery illness is not such a mystery if you start looking and thinking what's underlying this problem. Some people have had some really unusual exposures to environmental chemicals too. And so like, I kind of listen to them, try to assess their risk based on their history first. Correct. And then if I can say, if something really stands out, like I started feeling ill after I took a trip to a certain place where I had an acute illness, like that tells me something versus, I worked in a chemical plant in Houston for 35 years and then I retired and now I'm shaking and can't walk. Like that's.
Yeah. And I thought military, like in San Antonio, a lot of the military community have a lot of, especially from the, like the Afghan and, Middle East exposures and whatnot. I find a lot of people here in South Texas do that. So, wow.
Definitely. And what we're trying to do, kind of the conventional route, is give them a medicine to lessen the symptoms. But we haven't really explored more deeply, like, what did they get exposed to? And is there any option for, like, removing that or lessening the burden of it? I kind of hate the word detox, but, like, it really does needs to happen, like, whether it's through sweating in saunas or, IV therapies or combinations of different therapies. Yeah. Sometimes people will get a big improvement, and it's unfortunate that they can't get that from their regular primary care doctor or their neurologist because it's just not regarded in that way.
Well, let me ask you if and I'm sorry to interrupt, but you triggered a thought that because I think I understand the answer. Why do you hate the word detox?
Well, I think it's like a buzzword too, like, oh, you just need to detox. Well, that sounds like, stand upside down in your sauna and, count to 100 and then rub something on your knees and you're done. It's like it's really like waking up what's already there, because there's a lot of times it really is an interference. Like there's just things in the way of what's already God-given. Like God gave us ways to, like he gave us a liver, he gave us kidneys, he gave us lymphatics, and all of those are sort of, for lack of a better word, they're sort of overwhelmed or sort of struggling because there's so much that we have to deal with, especially the older we get, like the more exposure we accumulate. And then, I remember kind of going back to another grandmother story, but I remember when my grandmother got Tupperware, I was probably like 10. Before that, we had glass. We drank out of glasses. The dishes we used were breakable, and once in a while something would break, but we weren't ever using plastic things. And then all of a sudden, here comes the microwave and the plastic, and then everything's just plastic. And that's why, I think there's something not so good about ingesting things that are cooked in plastic, and it's commonplace. So, I mean, we built our house we lived in 5 years ago, and we don't have a microwave, and people just think we're the weirdest people, but we just don't microwave things. And we try to be, I don't think we're obsessed. We've learned that you can't be perfect. And so being, comfortably relaxed as well as we can do with our food. And we still go out to eat every once in a while. We're kind of picky, but we're not hermits because we want to be around people too, but just knowing that those things are, that's just part of it too. There's so much more now than there used to be, just for people to have to kind of deal with. So, we do need the assistance to detoxify, and we have those things built into us already. It's just the systems are somewhat overwhelmed. And so number one step is to start trying to be less exposed if possible, and then, wake up some of those overwhelmed systems and help support them to get rid of that stuff. So,
and that's why I think that, and why I asked the question and why I hate the word detox is because a lot of people will do it and they will start to rid them, or like you say, wake up whatever is underneath and going on. And, either they feel better, but they don't get rid of what is going on. So they just build up and then eventually have to do it again. Or they will start that detox, wake something up, and then feel worse and more horrible. And then they're like, I'll never do that again, when they were getting somewhere with it, so you can kind of ride both sides of the wave, but it is a buzzword. And it's like, just detox and you'll be okay. And no, that is not okay. But once you wake something up, if we find the root cause and you wake it up, yes, you've got to detox through it, but there's a way to do it better and slower so you don't have that horrible reaction. And so that's why the guidance, of somebody who knows what they're doing is very, very important. And so I agree. I think it's exactly what you said. And so just reiterated, but I hate that people have to go at it alone so much. And that is the problem.
Mm-hmm.
And so I think what we'll do real quick, Amy, is take a short break. But before I want people to know, I know you've got an event that's coming up. And so I probably need to clarify, whether it's more patient related or doctor related. Maybe if it's doctor related, you can encourage patients to tell their doctor, go listen to this. But I know you've got an event coming up, and then people need to be able to find you as well. So give us a little information about where to find you, and then we'll take a short break.
Okay. Thank you. So as you mentioned at the front end of our talk, I've had the honor of getting to serve as the president for ILADS for the last 2 years. I'm about to roll off and be the immediate past president, and Steve Harris is going to take my place. But we have our 26th annual scientific conference in San Antonio from October 9th through the 12th. Okay. It's a Thursday, Friday, Saturday, half day, Sunday. It is for clinical professionals. Yes. So it's a time when what we really want to do is educate doctors, nurse practitioners, pharmacists, naturopathic doctors. Like, we have a really beautiful constellation of different backgrounds of people as part of our organization. And we're a nonprofit. And really our mission is to educate so that patients, like we're saying, like you and I have been talking about, patients don't have to do it alone. They have somebody I tease my patients and say, you ride in the front with me, but you move out of the driver's seat. I'm going to drive for a little while, and you just sit beside me so that you don't have to feel so overwhelmed with what's going on. You're still going to give me your thoughts and feedback, but you don't have to be quite so I feel like that takes a little stress off of them, which can also help them heal. But anyway, back to the scientific conference, we're going to have some great speakers. We're going to have a workshop on IV therapies that can be helpful with patients who have chronic complex illnesses. We're going to have some other breakouts too. It's all up on the ILADS.org website. And so if anybody's curious about it, I would love for people to send their doctor, their NP, their brother who's disenchanted with the current kind of medicine. Doctors who don't love what they do every day do have other options. They just need to go and kind of see what they are. And Lyme disease, Lyme disease has become kind of a dirty word, and I'm sad that that's true. So I tend to just talk in different terms when I'm talking to other doctors. I tell doctors, if you have chronic complex patient cases and you want to try to help figure out what's going on, come to the meeting. Just be, like you said earlier, be open-minded. We're not only going to talk about Lyme. In fact, we talk about it, but it's a small part of the whole weekend because there's so many other factors that influence the care of these patients. So we're talking about all the other things, the terrain, so to speak, what's going on in the host, the human host. A lot of times the reason they're vulnerable to things like Lyme or BART or mold is because there's something that makes them set up for that. Yeah. So it'll be a great meeting. We also, for patients and just supporters of ILADS in general, we're having a gala that Saturday night that will also be at the Grand Hyatt downtown, and anyone can buy tickets. We're going to have a really good band. Brandon Allen and his band are going to perform. We're going to have a live auction and just fundraising for scholarshiping people that otherwise might not be able to come to some of our meetings. And so we're trying to, push forward with better education, better options, better care. And it's just a little bit of an uphill battle because out in kind of the mainstream medical world, there's somewhat of a resistance to this. I feel like integrated doctors are really where my focus is, because a conventional doctor that is already shut down to this, I'm going to spend my energy more on someone who's actually looking for better ways to care for patients. So anyway, I think anyone listening, if you've got someone like that, and even if they want to talk to me, if they send an inquiry to our website, our website is my name. It's amyoffuttmd.com. They can send an inquiry. I'm happy to call them, talk to them, let them know more about the meeting. They can look on the ILADS website too. But really appreciate you for letting me mention that here, because we're excited. It's going to be in San Antonio. Next year it'll be in Washington, D.C.
No, I'm glad too. That's one of my 4 to 6 week spots that I'm falling into. So it looks like I may be able to go, at least in part. So that is awesome. All right. Well, and then everybody can find a lot of information and even more on mold and Lyme from other guests that I've had on, drpbetterlife.com. But you can find out more about ILADS and Amy and everything from the website. Then all the links to the show. And so drpbetterlife.com. We'll take a short break and be right back.
Depression, anxiety, low energy, weakness. These are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
So that is Dr. Warren Lesser's company, a tiny little pharmaceutical company who's been supporting me and been on the show a couple of times. Great little group of people. I appreciate them very, very much. We're continuing on kind of chronic complex illness. I love the way you say that, honestly, because I've always said mystery illness, and patients relate to that very well. But in true medical terms, chronic complex illness, and it's complex, right? Body's a 500 piece. My audience has heard me say this 1,000 times. The body is a 500 piece puzzle, and each little piece is just as important. So stress, sleep, hormones, thyroid, all I could go on forever of all the different things. MTHFR is one big one, and the inability to make your folate, like the commercial says and whatnot. So a lot of different things add to whatever the root illness is going on. I'm sure you find that to be the same thing and follow that path as well.
Well, the things you just mentioned, I consider those like the foundation. So if I'm going to be a little silly and talk about puzzles, it's like the edges and the corners. You could start with those, and it makes your puzzle easier to put together. Things like nutrition, movement, hydration, general hormone optimization, stress is huge, as you know, and even just the stress caused by pain or sleeplessness are huge. So setting the table, I steal that from another doctor that uses that term, but he's like, let's set the table and then we can start working. And I think leaving those out is probably where some people don't get better, and I don't ever start with you need to start going to the gym 5 days a week for an hour.
Right.
But when they tell me, some patients will be like, I went on a hike last weekend for the first time in 5 years, and I know we're on the right track because they're starting to do things that they like to do. Right. So I do give them a shove in the exercise direction once they're starting to feel better, but I usually start with just the basics and then trying to figure out why are they so inflamed. And if I can figure out why they're so inflamed and address that, the inflammation starts to diminish, and then they start to just slowly feel better. It also takes a while, which is the hardest other part. And they all know, though, that they didn't get there in 2 weeks. They're not going to get where they want to go in 2 weeks. It amazes me how patient some patients are for letting slow, subtle improvements happen. But it is just a slow, steady process. And if we can kind of hold hands and keep going, it does happen for them. They just don't give up on it.
That's a great point. And what I find with my patients is that, they come in, of course, they want to find that one thing, fix it, and instantly feel better. And I get that. But sometimes I notice if they don't get, kind of more instantaneous results, and if I don't build in for them that it is a process, then they'll get frustrated, switch doctors, and then they have to start all over again. So that's all you do is switch doctors and start all over again. And I try to encourage people, stay with me. You may not be, I know it's been 6 weeks and you haven't really noticed much. It just means it's time to take the next step. So let's keep going, because if you just give up and switch, you start all over, you'll never get to where you're going. Mm-hmm. I'd love to make a point on the exercise thing. So I say it almost every show, and I know people are exhausted from it. I was 300 pounds, but I had been on prednisone, been very, very ill, from rheumatoid and all. And I have found on my, there are days, and I hear patients say, I'm too tired to exercise. I just don't feel like exercising. And I've been exercising for 8 years now. And I can tell you, if I go on a trip or something and I'm not exercising, I come home more stiff and a mess than when I get up and I go. That first 10 minutes, before I get out the door is awful. And maybe the first 5 minutes getting started. But by the end of my workout, I feel so much better. Thank God for Dr. Wickersham, who just told me, he just planted the seed. Because I think I'm a patient too. And I think like everybody else, it hurts to exercise. I don't feel good. But now I don't feel good if I don't exercise. And he's the one that planted that seed and said, Marianne, when you exercise, you push inflammation out. And that helps, get the joints moving, get the inflammation going out. And that way you can do more. So I think, we need to flip our thoughts about exercise. And again, we don't suggest somebody who hasn't been to the gym to go 5 days a week suddenly and spend an hour at a time. No, it's just not necessary to start that way. And you're going to, discourage yourself and hurt yourself. So don't do that. But start with a walk. Just kind of slowly get going, get moving. You'll find you get addicted to it after a while. I can't go without it, right? And I have very severe disease. So it's like, but it makes me feel better. And it will. So anyway, I'm sorry to interrupt, but I think that's
things I love that. We just added one of the other people on the board with me for ILADS. He treats a lot of athletes too. He kind of specializes in concussion and how that makes infection and mold illness worse.
Yes.
So he had suggested to a group of us that we look into blood flow restriction exercise, because for patients who maybe can't, imagine going for a long walk because they've just been in bed, like for them, walking to the bathroom still is kind of tough.
True.
We have a physical therapist in our office who we have blood flow restriction bands from Owens Recovery Science, and we'll just exercise them with, it's basically guided exercise. And when you restrict oxygen to a muscle and then work the muscle thinks it got a big workout when in fact it didn't get as much of a workout. It was a little bit of a shortcut to building some lean muscle. And then they can work their way back to where, they're not so sore from walk around the block or, so like helping people, like swimming is so good if you're just starting out because it just doesn't pound your joints and muscles as much. Stretching, oh my goodness, like if you could just stretch, if you don't feel like you can effort, I'm talking about my sickest patients, like just do some stretches in the morning and you'll start to feel a difference. So I'm totally with you that like doing something every day. I try to ride my bicycle to work, which my bike has a flat right now, which is sort of making it hard. But I have a little walking pad under my desk. So when I'm doing phone visits, I walk usually while I'm on the phone. My daughter is the one that said, Mom, you should do that. I'm not a natural exerciser. I could just sit in a chair and read a book all day. Yeah. But I know I need to, and I want to be one for the sake of just feeling good and aging well. And, so I often will commiserate with my patients and say, I know you don't want to, but if you just, like you said, Marianne, if you just get going, getting there. Brad and I have also been playing a lot of pickleball in the evenings.
Yeah.
So that's a good movement, some days it's easier than others, but it's like super fun. So it kind of lets me forget that I'm running around and chasing a ball and,
I know there are people, like you say, I remember getting up and I would get up like 2 hours before work and just sit in the shower till the water ran cold, just saying, I've got to go. I understand. I spent years in bed. I couldn't even clean the old, infant clothes out of my children's closet. They're 5 years old and they're still infant clothes hanging in there and in drawers. And I just couldn't do anything. It was awful. Mm-hmm. But I did find it took me 2 solid years to get my body turned around and going, despite still being ill 19 years later. But I go 5 days a week for an hour. I lift weights and I run. I do it. People think I've got a fused ankle and everything. I still do it, but my body needs it. And I built up very slowly. So I went from bedridden to this point. It can be done. So even as sick as you are, you can, but do it under guidance. I didn't do any of this alone. I had guidance. I had a great trainer, Sonia, who is here in town, and still use her 8 years later. I think I have bought her probably a couple of houses and cars by now. But it's worth it because I don't eat out. I don't buy lots of bad food. I don't do things that are bad for me. I just shifted my money away from what I was doing that was bad to now doing something that's good, and that made it affordable. I know I'm a doctor, but I'm not rich. I work I accept insurance at the clinic. That doesn't make you rich. So it's just shifting around. So it's a lot of shifting your thoughts and priorities, I guess. You just prioritize your health and switch it up. And I didn't, I think you said something too, listening to your patients And what was working for them is always a great clue. I think that me being sick has led me to find out different things and do different things, just testing it, on myself in a way, because who knows? Nobody knows out there what it is.
Yeah.
You probably do. You've invited me 1,000 times to come see you, and I should, and I think I'm going to now. I'm done. 19 years is long enough. But it's just very important in finding somebody who is open to what you're needing. And so, any thoughts that we haven't tied up? Anything else you can think of that is important to getting to the bottom of chronic complex illness? I love that. And anything else you can think of?
Well, I recently had the opportunity to interview Daniel Amen, Dr. Amen, Amen Clinic doctor. And it was for ILADS for a webinar. And at the end of our talk, I asked him what he does every day for his brain health, because, brain health is
huge.
It's huge. And I thought he had already talked a little bit about things like exercise and nutrition and some supplements and things like that. And I thought he would say something about his routine, but he said that his most important practice that he does for his own brain health every day is he gets up and he looks in the morning at himself in the mirror and says, today is going to be a great day. And then every hour he tries to think of something good for the last hour, even if there was something bad. Yeah. And so it's funny because as he said that, he's written like 40 books or something, and they all pretty much point in the direction of positive thinking. Yeah. Which, it's hard when you don't feel well to have a positive thought. Yes, so I think our role sometimes is helping patients find some little good in all of the negative that they have encountered. And then, helping them build from that more of a, like, what can they be grateful for, or what are they, excited about or looking forward to, and, practicing that ourselves. It was funny because, how when you do a webinar and a lot of people are on, they'll put messages in the Q&A, like a question. And someone said, what if everything in your life is negative? Just like, we were at the end of our call, and I was like, okay, I don't know if I'm going to give him that question. And I didn't, because I knew he was going to just start over and say, start with somewhere, like start somewhere. And the other thing I always like to say if I had the chance is for patients, is like patients are their own best advocate. So even if a doctor has told them you're fine or you're normal or this is your only option or you just have X, I don't care if it's bipolar or rheumatoid arthritis. I think those are all caused by underlying triggers, infections, toxicities, exposures. You have to go digging for it and looking for it. So if someone's doctor isn't approaching their case in that way and they want that, it's going to be up to them to go find it. Or I tell them, find a doctor that's nice or that has like a heart for you, like that cares about you, and tell that doctor, hey, I've been looking at root causes of my condition. Would you go learn more about that? And send them to ILADS or send them to integrative medicine training or direct them. And if enough patients do that to a doctor who still has a heart for patients, they will eventually start looking for the light bulbs like you're talking about. And that's the only thing that's going to change it, because when, it's kind of sad. I don't know the fix for the corporate medicine overtake, but that gets in the way of this. Yes. But doctors who are burned out, if there's a doctor listening, if they're burned out, you can practice without that corporate employment. It's just a matter of finding somebody like, us who could give you a little bit of, I had that, like you said, I didn't do it by myself. I had encouragement, I had Brad, I had a nurse, I had, people who I was in school with, learning integrative medicine, saying you can do it. And it just takes a little bit of a leap of faith, but the care and also just my own personal satisfaction for what I do every day is like,
sure.
You're
a good doctor. You're going to look for what you do.
I think, the ultimate joy is found in contributing to the good of other people, not in contributing to the good of myself. And so, this kind of medicine does contribute to the good of other people. And it does put some other doctors off who haven't learned it, but that's just because they haven't learned it yet. And hopefully they will. And if they don't or can't or won't,
go to someone else. Good.
Yeah.
Where's a good place to look for more integrative style doctors?
So, if you look, there's a lot more organizations now that are bigger than when you and I started, it was definitely smaller. When I started at A4M, it was 2010 or 11, kind of the end of 2010 was my first class.
Yeah.
I think there were only 13 classes. Now there's hundreds. And Brad found them and he signed me up. He did a deal with somebody to get 5 classes for the price of 4 or something. So I just take 5 classes, which is good because I don't know if I would have gone back after the first one because it was so different than what I knew. I was overwhelmed by it, but I went. And I just look backward and see God's hand in it. But A4M, IFM, there's online classes now. I did the integrative medicine master's at GW.
Yeah.
I have known a couple people go through Andrew Weil's programming, and I feel I don't know, I didn't do it, so I can't speak to it. I feel it's more oriented toward a little bit of Chinese medicine, which I think Chinese medicine is part of integrative medicine, but it's not the everything of it.
Right.
So, some of it is budget. There's a couple of online programs that I've had different NPs do over the last several years that have been really good, modular education and learning. So there's so many options.
Nice. And for the patients, I usually send them to A4M, the letter A, the number 4, and the letter M, as in medical, .com, and send them there. And there's a find a provider. Mm-hmm. And so I think IFM has something like that too. And so I don't know if you guys have something like that on your website.
Do. We have,
there you go.
I think we had, if I'm not mistaken, over 35,000 queries last year because so many people think they have Lyme disease.
Yeah.
And maybe they do, but they may have Bartonella instead and actually it's really, if the medical literature, if people were looking for it, they would find a lot of papers being written these days about the neuropsychiatric symptoms of things like Bartonella. So all these little kids, that's why I serve on the PANS Advisory Council for Texas, is because PANS is an autoimmune disease. It affects the basal ganglia of the brain. It makes kids have obsessions and compulsions. It makes them be very anxious. Separation anxiety is huge. It makes them refuse to eat. Yeah. And so these kids, instead of getting treated as if they have an autoimmune disease, they get treated that they have a psychiatric illness.
Right.
And what's wrong with them is autoimmune. And just the way they look is they have a psychiatric problem. And they do have behavioral problems. It's not that. So you have to address that. But if you also address the immune issue, the inflammatory issue, the infection issue, they get a lot better, a lot faster. And sometimes they don't need to be on antipsychotics and anxiolytics and antidepressants.
Absolutely.
And ADHD medicine, every other child is on ADHD medicine. And
absolutely.
I just think we should, instead of just diagnosing, I have had so many patients, even doctors say, I have ADHD. I'm what is that? What is ADHD? Yeah. It's a disorder. Okay. You have trouble focusing and concentrating, but why? Why do you have that? You don't just have it spontaneously. And it's hard for people to wrap their head around that there is something underlyingly causing them to feel these issues. And so it gets better if you start to look for those underlying issues and treat them. So, I'm not saying everything is caused by anything. I'm just saying that everything should be looked at through basically the approach of what else might be going on that we haven't looked at that we could address to get someone better, rather than just, so many people, I haven't looked in the last year or so, but huge numbers of people are on 8, 10 drugs every day. And they wonder why they have brain fog and sleep issues, and they're tired and they're on too many meds. They're just on too many meds. And I use a lot of meds, so it's not, but my goal is not to have them on them forever. I use prescriptions when I need to. I use herbs when I need to. I use the biggest toolbox I can find. I use non-medicine, non-ingested things, some IV therapies. We try to tailor it to each person's kind of preferences and need and what they've already tried and what they have. And so it's, I probably only see 4 or 5 patients a day, most days, because we do deep dive. We're trying to really figure out what's going on with them. Absolutely. And I think it does help. It helps us get them where they're trying to go.
Absolutely. It takes that kind of time. It really does.
It does.
It's lacking these days. Absolutely. So, oh my goodness. But Amy, thank you. Where can people find you and information too on the gala and the your event?
Yeah. So for me, I'm at amyoffuttmd.com. My practice is, I have a practice in Marble Falls, and we have a satellite clinic in Burnett too, which is about 12 miles north of us. And then for ILADS, ILADS.org is the website where anyone can find more information on the conference, on the gala, and just, ILADS in general. And there is a finder provider there too. And we have a lot of great members of ILADS. I would say what we all share, we have a lot of different unique perspectives, but we all share that we want to help people get better.
Yeah. So. Love it. Thank you. So all that will be on the website, drpbetterlife.com. Please go on, see all my previous shows and information, and your information will be there. Just click and go find it. And I appreciate you, Amy, so much. It's always a pleasure to talk with you. And I'm so proud of you and what you've accomplished and what you are doing for people out there. Thank you for your service in that. You have been wonderful. And
I'm proud of you too, Marianne. I'm so proud of you and love that you're doing this, and love that you're using your big personality and your big heart to share good information with people.
Thank you. Awesome. I think a big personality and big heart going together is important, because that big personality sometimes gets in the way. But thank you very much.
I know your heart. You have a big heart.
Thank you. Awesome. Well, everybody have a great week. Take care of each other out there.
You've been enjoying The Better Life with Dr. Marianne Pinkston. For more information, go to drpthebetterlife.com. That's drpthebetterlife.com. And listen next week for The Better Life with Dr. Pinkston.